We have standing by Sergeant Fernando Esteves, the Medical and Operations Logistics Coordinator for the Guam National Guard's Surgeon Cell. Good morning, Sarge.
Good morning, Chris,
How's the
Sabrina. How
day?
are you?
We're
Doing okay.
doing okay. Thanks for joining us, man. It's been a minute, Sarge, and we just kind of wanted to fold you back into the conversation. As I remember, we spoke with you back when we were really anticipating that big surge, and there was morgue preparations going on. There were field hospital. There was a lot of prep, and then the numbers kind of tailed off from there. Yet here we are again. Unfortunately, in an all too familiar spot. So I guess if you could just starting at maybe run us through the surgeon cell's role in the COVID-19 response as we stand here today.
Yeah, absolutely. So the surgeon cell is kind of the military component of the Cure Action Team, which was the COVID task force stood up through executive order by the governor of Guam. So it's composed of medical people from the National Guard, so physicians, medics. We even had medical human resources that were part of the task force, as well as civilian component. Dr. Cabrera also included are the physicians of the PAG. And so this COVID task force looks at a lot of the data and makes recommendations to the governor based on data and different avenues she wants us to look at towards the response. And so initially our primary focus was to prepare Guam for a medical surge. Overutilization or going over capacity of the hospital. What do we do then? What's plan A, what's plan B, what's plan C, and plan D? So we did that, and then we focused on both response and recovery, right? How do we now protect Guam once we saw those numbers come down? And so that's been really our driving effort throughout this pandemic since March.
We just spoke with the Guam Memorial Hospital Administrator, Lillian Posadas, and she mentioned there was an ops meeting yesterday in which the governor instructed, I'm not sure if it's the surgeon cell, to look into ordering these specific tents in the event that we're going to need to establish a field hospital. Can you tell us a little bit more about that?
Yeah, absolutely. So the tent she's describing are the brand is actually the BlueMed. They're an Alaska structure, which is overall manufacturer that also manufactures military grade tents that are utilized by the federal government. These particular tents are designed to quickly increase capacity overall for the hospital to potentially take in additional patients for the surge. The big concern was, what do we do if we run out of beds, right? And we don't want the hospital or healthcare system to be turning people away for inpatient care. So the BlueMed tents being an alternative to that. The main thing about it is they're equipped with environmental control units, and most importantly, they're all built with negative pressure units. And so each tent acts as an isolation room to reduce risk of infection for those working in those tents, especially because they're small and compact. And so with those tents, once they arrive, would increase that capacity by 200 beds. And the important thing about that is those tents will take about a day to set up to increase our capacity at the hospital by 200. And so that was an option that the governor had wanted to be able to quickly react if the need were to arise, as opposed to having long-standing, contracts and just have that held, for example, with a hotel. And so the option to quickly expand was to reinforce our overall capacity and basically allow us to start looking at opening some services up.
Mm-hmm. So how many BlueMed tents are we looking to order?
20.
20 BlueMed tents. And how long does it take to arrive?
That's still in the process. That's not my lane. As I understand, it's being worked at GSA as we speak, which should be the final step.
Mm-hmm. So we're planning to order 20 BlueMed tents. What about concerns about the weather as we head into typhoon season? Are these tents going to be able to withstand heavy weather?
Yeah, so there are alternate plans.
Okay.
We've looked at, the thing is that they're an isolation unit. So it's not necessarily the fact that it's a tent that it can be set up outdoors. It could also potentially be set up indoors, whether it's at a gym, field house, the United hangars up at the airport, any place that is weather resistant. But the fact that it's negatively pressured means you can quickly set it up at a location, and it'll be controlled environmentally and protect basically those within it and those outside of it. And so that has been considered. But the other important fact is the fact that they're able to be both put up and taken down very quickly allows us to react react if a storm were to come. And so it does give us a lot of preparation time beforehand and afterward.
So then are you guys also looking at staffing, hiring?
Absolutely.
Right.
Absolutely. And so as the governor had mentioned, we do have currently a working plan in place with DoD counterparts from the 18th Med. And so, we're in constant communication with them. So we have those contingency plans. But that's not to say that we haven't been doing everything we can locally, really over a long period of time, but really pronounced now to continue to try to increase our healthcare personnel, right? We know there's a national, really a global shortage of nurses, critical care nurses even more. And so while that was a problem before, it's exacerbated now. But these things are always on the radar. And so we're always in a steady state to try to recruit experienced critical care nurses, which is one of the requirements to run an ICU bed.
So we're looking at DOD. You said
DOD plus internal capacity. There is the ability to shift nurses around. We're in constant communications, and that's part of also what the Surgeon Cell does, is links up both the private and the government healthcare system, whether that's the clinics or the hospitals. And so the ability to shift medical personnel should the need arise as well.
What about the Army Corps of Engineers? I remember they were here months ago when in the heat of things during the first Peace Corps 1, and they did an assessment of different facilities on Guam. Are you guys talking to them again?
So those assessments are complete. Those plans are ready. If there were a need to basically convert a hotel into a hospital, that option is there. But as you had stated before, it has to be equally balanced. Both expanding bed capacity has to be equally balanced with our ability to staff them as well.
Yeah.
The current plan that we have right now can expand Guam fairly quickly up to 200, up to, I want to say about 300 to 400 beds, which also includes internal hospital surge plans for both GRMC and Guam Memorial Hospital, which they already have in place. The BlueMed tends to augment that specifically for COVID, plus an additional, I want to say 200 with the next phase after that. So again, everything is in tiers and phased, and we're closely monitoring it, and it's always going to be based on current resources on hand. And when I say current resources is as we start seeing an uptick in total bed capacity, that's when we start turning on the next trigger and the next trigger. So everything's phased. One of the concerns with the Army Corps of Engineers is they would have come out at a cost share to basically renovate an entire hotel to turn it into a hospital. But that need, we were not close to it at the time. And so it didn't seem feasible to move forward with that, because we start doing renovations, we basically are paying and owning that hotel until we're done with it and convert it back to its original state.
Sarge, really sorry, I got to take just a really quick break, and then we'll come right back to you. Sergeant Fernando Esteves from the Guam National Guard Surgeon Cell. He's the Medical Ops and Logistics Coordinator. Hey, to our viewers on KUAM TV 11, thank you guys so much for watching. Let's all tie our shoes and go over to our KUAM News Facebook page where it's Edward. I don't know where that tie your shoes. I don't even know. I'm wearing Zori. Tie your Zori. Where it's Edward R. Murrow award-winning social media networks. Again, to our viewers on KUAM TV 11, thank you guys so much for watching. We'll see you either on the Facebook live feed, of course, or on the link of the Breeze 93.9 FM or KUAM FM in Hagatna, Guam. Good morning.
Where's the best breakfast value on Guam? Wendy's. Try any of their 5 local breakfast platters with eggs, rice. Whether it is tablets for children, special equipment for special children, or coral reef research, federal support is critical for our schools and our future. This week, we're trying to open schools. Parents are worried about their children's safety. Teachers are being asked to work minor miracles every day in teaching without looking directly into the eyes of our children. We must make sure that every child has a tablet, can get online, and get on with their education. We need a congressman who understands education and how the federal government can support every activity in the classroom, in the laboratory, and in the internet. Now more than ever, we need a congressman who will assist GDOE, UOG, and GCC without hesitation in solving problems with federal agencies. It's time that your child takes center stage, not only in school, but in Washington, D.C. I'm Robert Underwood, and I approve this message.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Half a day. My name is Kathleen Fernandez, and I'm a registered nurse at the Department of Public Health and Social Services. The Centers for Disease Control and Prevention recommends wearing cloth face coverings in public settings. Don't let your guard down. Prevention saves lives. For more information, please call 311 or check out our website at dphss.guam.gov.
We got your 6
at 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6. Hey, for those of you just joining us, the Link staff bringing the negativity this morning is thank you guys so much for your concerns, your words. Man, my phone was just going off yesterday as some of our essential staff have tested negative for COVID-19.
We're still waiting for the results for the rest of our news team.
Right.
So hopefully everything goes okay.
Okay, 8 o'clock. Let's go ahead and jump right back into the KUM News Zoom room where we have Sergeant Fernando Esteves, and I know Bree, you were...
Yeah, I wanted to follow up on the BlueMed tents, and we were talking about the need for staffing of those tents, but what about equipment?
So the intent with the BlueMed tents, right, that what we know COVID that we started seeing the reports early March is that majority of hospitalized ICU patients are patients requiring oxygen. And so oxygen being the key thing, that's already been assessed, and there is a plan for that. And so the studies that have been coming out, prognosis and case studies with COVID patients, are that patients that are identified and provided oxygen early on tend not to increase their level of care required. And so somebody who may be hospitalized, monitored, cared for, and for the most part just provided medical oxygen, we're preventing them from potentially becoming a ventilated patient. And so the need for that increased capacity is really towards that. And so equipment primarily, or equipment to take vital signs, monitoring, and then oxygen to be provided to those patients. And that, for the most part, that's what we need. We want to keep the higher level of care patients within the heart structure, and of which there is equipment for them.
Okay, and so as you order these BlueMed tents, you're also ordering the oxygen and whatever else you need.
Yeah, and actually that can be supported locally. Yeah.
Okay.
so locally we have the capacity to support that amount, and so these are all things that were looked into, calculated, planned for, prepared early in the pandemic.
What about the Federal Emergency Management Agency, FEMA? I think, I want to say when we spoke with FEMA Frank Mansell months ago, he was mentioning, and he even confirmed with us that they had, we had received 10 field hospitals or something like that. And I think they were like
So
50 bed hospitals.
yes, I can
Tent
speak a
hospitals?
little bit about I can speak a little bit about that, but again, in more conversation about FEMA, I'll defer to them. But what they were speaking about were the field medical stations,
The
which
FMS.
are supposedly 50-bed medical stations that were supposed to come equipped with the supplies and equipment. But really, what they are, they're 50 cots, and so we have 100 of them total. The set's not complete, and so that's not to discourage anybody, because our local capacity and the BlueMed tents already come with the beds, and so the equipment we and supplies we were always understanding we would need to fill on our own, but by and large, the FMS is primarily just medical cots that were sent over by FEMA.
Sounds
And
fancier
so
when you
again,
say FMS, though,
again,
right? It sounds fancier when you say field medical supply, and then come to find out it's what we saw in the old show MASH. These are the medical cots.
exactly,
Right.
exactly. And again, we there's been a lot of support provided by FEMA, and this pandemic has been a strain to all governments, local and federal, as well. So there's again, this is not speaking poorly on them, but
Yeah, yeah. No.
this is why we want to continue to plan for our
Of
local
course not.
capacity,
Yeah.
because we have an expectation of what we're going to receive, how to account for it, and to plan for its usage. And there's no there's no magical solution that's just going to come our way. So it's a constant work in progress. And again, that's always centered around the core goal of the surgeon self is to center that around our nonstop effort to improve our own capacities here locally. So we're not 100% dependent, because that support from the federal government is really dependent on what's going on in the rest of the country. So if we're not as bad as other places, we're much lower on the totem pole.
Right,
And so
right.
it becomes more difficult to rely on that assistance.
Right. Yeah, we've talked with FEMA Frank before, and I mean, even FEMA is stretched right now, and they were stretched when we talked to them 3 months ago. So, Sarge, I kind of why I brought you on here, and it's and hopefully you can talk about this. Is at the press conference, the head of the surgeon cell, Dr. Mike Cruz, had talked about an enforcement component, right, with the PCOR 1 measures. What can you tell us about that?
So what I really want to discuss is it's not so much about the PCOR 1. I think we saw through data that a lot of the clusters that are related to the cases that we're seeing now involve situations, group settings, social settings, where protocols weren't followed. And so primarily, I think we've all seen it, right? I mean, raise your hands if you've gone into a restaurant, and I'm just gonna level with you, Chris. When you go into a restaurant or you go anywhere, or even see on social media that people aren't wearing their masks, right? And so we understand the component that public health has placed upon establishments, eating establishments, and businesses. You require a mask to enter. But what we're not seeing is the enforcement component within those places. Because if you go into, let's say, a bar, if you go into a restaurant and you wear a mask when you cross through the door, but once you're in, all bets are off, then it becomes pointless at that, right? Or it becomes pointless in that situation. And so we really have to, as a community, be practical about this, that when they say mask, it means use the mask, and use the mask properly. And that's the only way that this is going to work.
Right.
And so I think we've all seen it. And so now that we've kind of seen how this can happen, that's where we just need to tighten it up. But I think it would be too unreasonable at this time, considering everything going on, to, for example, have public health, hire another 500 enforcers, right? That's just not practical.
Right.
Or GPD to be going out citing people for masks all day because that's what they would be doing.
Right.
I think we really need to work together and look to our left and look to our right and really support each other and kind of remind each other. I know from firsthand experience, Chris, um, that it's very stressful and it's exhausting to be on your guard 24/7, right? It's as human beings, we're not really designed to do that.
Right.
But I also know from experience that when we're being human and when we start falling short, we need those people close to us on our left and right to really lift us up and get us back in that game, right? And we have to do that together because it is exhausting to be on your guard.
Yeah, and
But the issues like this arise, the danger to yourself and danger to others arise when you let your guard down and we become complacent. And so I think that's kind of the key takeaway, is that we need to really kind of police ourselves, or not even police ourselves. We need to support each other, and just kind of have this constant reminder.
Right, Sergeant, maybe you could go over the protocols with us again, but I know exactly what you're talking about, and I don't want to name any names, but again, it's a restaurant in EPEN where you're supposed to wear a mask in the restaurant, but you're right, once you cross into the restaurant, you don't just throw your mask in the wind and go take a picture over here with this person and take pictures all with no masks all everywhere. And I think part of it is these business owners who've got this harebrained, like Fox News anti-mask COVID-19 is a hoax mentality, and it's dangerous. I think it's dangerous, and there does need to be more enforcement because you're right. Even we saw it with the bars where, I mean, I believe the protocol, and I only went out to dinner once and tested, but you wear the mask, you go into the restaurant, you keep the mask on, and correct me if I'm wrong, Sarge, you sit down, and it's only then that when the food comes and that you can take off the mask. And if you get up
afterwards, you put the mask back on if you're gonna stay and have a conversation.
Right.
And see, that's a very practical way to look at it, and I guess that was the initial expectation. But I don't want to say that it's all bad, Chris, right? I'm not here to badmouth what's going on. It takes a village to raise a child, but it's going to take the entire island and community to get through COVID. And again, it's more about uplifting us with a Nafamalic spirit, as opposed to being overbearing, right? Because it's a lot to ask a business owner. It's really a lot to ask the government. And again, the best response is that we kind of take care of ourselves and police ourselves. I mean, in my experience so far, I think people early on were saying that children are really going to hate this, but honestly, children are adapting pretty well to the mask policy.
Right.
And my daughter's 3, and we've gone to a couple places, and she calls everybody out.
Yeah. Oh man,
asking, Daddy, why is everyone not wearing a mask? Where's their mask, right? And it's unfortunate that we have to teach our kids these things, but they're getting these concepts, right? They're understanding it.
I mean, dude, if my 7-year-old
Sarge, adults that have to break these bad habits.
Yeah, my 7-year-old, we go somewhere, we drive by, and this is even in P-Core 3, and he'll see a huge gathering, and he is just straight up like, don't you guys know about coronavirus? And it bothers him. Like, he's like, Dad, the COVID, Dad. And so, I mean, maybe, we need to look to our youth to get a good example of this. Because, if my 7-year-old gets it, then, restaurant owners and bar owners and especially the people of Guam should really get it. I mean, it's not that hard. And it's not that much of a hassle.
It's not. And to each their own. And the unfortunate experience that I've had, and I think many have had in the medical community, is most people disregard these things. But the unfortunate aspect of being in the medical field is you see the very sad, low moments, right? Where, these things are never expected until it happens, and then it's there, right? And all of the priorities fall by the wayside, right? That the health of your loved one is the most important thing. And so, we can keep on saying that this is for everybody. We need to support each other as a community, but most people will just, turn a blind eye until it happens to them. And we don't want that, right? And so, why I want to keep reinforcing that we need to maintain these standards, and we have to be very practical about it.
So, Sarge, I mean, basically, you're saying that the enforcement component falls on us, and there isn't, I mean, short of hiring people, like you said, there's not going to be a COVID meter maid that goes around and cites you for your no mask or COVID cops.
No, exactly, and you know how our community is, right?
Yeah.
Chris, Sabrina, you know, we get shy, we get mamala to, dime somebody out or call them out. We don't want confrontation, right? But we can't look at it as a confrontational moment, right? When we ask somebody to please put their mask on, right? What we need to look at it is we're helping each other and the community get through this together. And so that's the main thing that I want to emphasize that we have to keep supporting each other through this, because if not, then we can see potential spikes like this come again, and this is exactly what we want to avoid for everybody. I mean, I want to say the silver lining to all of this, right, if there's any, is that we've seen Guam at its very best, and that's when we flatten the curve. I mean, flatten the curve. We kicked COVID's butt. And then we're also seeing now what complacency looks like. And so, I mean, the numbers are very telling. The positivity is very telling. Hospitalizations are telling as well. And so we've seen Guam both in its finest hour, and we've also seen it as we've kind of relaxed things. And so we just have to keep on, as a community, figure out where that happy middle is, right? And so again, it was tiring enforcing those policies amongst each other for in the very beginning, but we saw the positive results of that. And so that's the only thing I'm going to ask Chris is, we all kind of look to our left and our right, and we try to really reinforce and support each other to follow these guidelines.
Right on. Look left, Chalu. Look left.
Look left.
Fernando, I know I keep harping on these BlueMed tents, but I really just got to ask, why are we just now ordering these? Why didn't we order them back when we were talking about a possible surge, when the numbers came out and, we're looking at, all these tests, positives in September? Why are we just waiting now? It just kind of is concerning that, well, look, now we're going to order them because we're seeing 42 positive cases. We're seeing this and that. It just seems like if we are supposed to be prepared, why didn't we do this before?
Sure. What I can say, Sabrina, is that the decision to order these tents, I want to say approximately were early April. And I'll leave it at that, but it is in a process, following our procurement laws and rules and going through all the proper channels. It is in a process. But what I can say is that's absolutely not true, that the only reason we're ordering these is because of the current situation and the current positives. These were part of the plan, and moves, especially from the Surgeon Cell, were made to get this done early on. And so, with any government, things take time. And so,
Okay, I'm just asking that because Lillian just told us minutes before you came on that there was an ops meeting yesterday and the governor instructed that these tents be ordered.
Yeah, I can't speak specifically to what was discussed in the ops meeting, but I will stand by my statement. The decision to purchase these tents were made in early April, and the process began. And so the Surgeon Cell's main responsibility was to find something that would meet these goals and that would be suitable for the plan, as well as to review and evaluate the specs, and also develop the specs for these tents that would meet our need. And so that was our main focus, and that was accomplished. And the decision to make the purchase was made in early April.
Right on.
At that, and then all I can say after that is it's at GSA. And so that's the information I have. I'm able to provide the nuances of inter-government working. I was activated for this response. I don't normally work for GovGuam, and so I couldn't begin to tell you.
Okay. But just as of today, no tents, no equipment. and we're just still waiting to, we possibly are working, or we're working with the military to get staff.
Yeah. Well, no. Yes, the military is an option if needed. Equipment, primarily oxygen that we discussed, is available on island, and we can get that as needed. The actual physical space, i.e., being the tents, is in the works. But again, remember, understand, the plan is phased, and so the hospitals, both hospitals, have internal surge capacity, and so we have to meet those thresholds before we start setting tents up in the parking lot. And so that's why the situation is monitored very closely, because as we meet certain thresholds, we move to the next subsequent steps.
So have you guys ordered anything? I mean, did you guys have, I mean, how much money have you guys spent since March for COVID related issues?
I'm not the finance person. I wouldn't have that answer. Again, I look and I determine, part of what the team here does is look and determines the need. They have, I couldn't speak to the financial and fiscal aspect of it.
Have we
Again,
received
ours is
anything
based
then?
on medical
Have we
need
received
and necessity.
anything? Have we purchased
I'm sorry, say again?
anything? Have we purchased anything or received anything the surgeon cell has done to fight COVID?
Yeah, so we do have emergency field medical beds similar to the FMS, but these are, higher quality and grade, and we don't run the risk of the federal government taking it back with a different need. So that'll allow for potential expansion in a hard structure facility that we're able to acquire. And so that's an additional avenue. And so those are on its way. Those were also ordered back in April, I want to say. But again, those are, we have to also deal with manufacturer issues, because a lot of the manufacturer for this equipment is also backlogged as well. So it's a slew of things. But what we look at is the total lead time to get these items here and available for use. Again, luckily though, our current number, while we see higher numbers in the hospital, we have to look at the overall capacity of the medical facility. Which for GMH, we're looking at over, I want to say close to 200. And so we're not there yet, but it is being monitored. And again, we have steps and in place, and plans in place, and steps to take if we start meeting these trigger points.
All right. Thanks, Fernando.
Thank you, Sarge.
No problem. Thank you.
All right, we'll see you. Wash your hands.
Will do.
Got it. 8:20. Let's keep it going in the KUAM News Zoom room. The Vice President of the